So tonight is another night of our summer speaker series, and I'm very excited because the lovely Robin McCulloch from Lethbridge, Alberta, is going to share with us some of her excitement and passion about working with feet and ensuring stability within the feet. And we're very lucky at the Lymph Balance Center because Robin comes up every once in a while and looks at feet and braces and compression garments for us. So I'm very excited that you're able to share some of your fun stuff tonight. And I'm going to pass it off over to you, Miss Robin, and we'll get started.
You bet. Well, thank you, Robin. And I always have to call you Robin Divine to separate us. Plus, I love that last name. I want to thank you for inviting me to be part of your summer speaker session. Yes, I've been very fortunate to be introduced to Robin and her wonderful team at Lymph Balance Center, and looking forward to continuing building my relationship with them. Tonight, our talk is going to be focused on what I feel is one of the most important part of our body, which is our feet. So the topic is don't forget the feet. So I definitely want to introduce myself. My goal is to talk about foot pain and foot conditions and how orthotics could perhaps help that, as well as knee pain and back pain and how that relates to the foot. We'll talk about shoes because you have to put your foot into something, and shoes are important. I know that there's already been some talk about compression socks through other speakers. So just kind of briefly go through that. A lot of people always ask about insurance, like who pays for all these things once they know they need them. And then of course, open it up for any questions at the end. Hopefully about 35 minutes, and we'll let you go for the evening. So just introduce myself. Thank you, Robin Divine, for doing that. But yes, my name is Robin McCulloch, and I am the proud owner of HiTech Bracing, which is a full-service orthotic facility or brace shop in Lethbridge, Alberta. Been down here for, it'll be 22 years in November. I did start the business when I was 24. This is my building behind me here. For those whole 22 years, I've actually continued to work in Calgary as well. So we do have some Calgary locations. But I am a Certified Pedorthist, which is a really fancy word for someone that looks at feet all day. So Foot Orthotic Specialist is what some people may call me, but the word is a Pedorthist. I'm also a compression sock fitter, and my degree is in Kinesiology. So this is my office right on 3rd Avenue, 1321 3rd Avenue South. That's my main location. Like I said, we're celebrating 22 years in November. However, I do offer my services at through 3 different satellite clinics. So in Calgary, the Downtown Sports Clinic, Calgary Muscle Soft Tissue Clinic, which is close to Mount Royal, and Lymph Balance Center, which I'm excited to be there. So we do offer our services every second Thursday, and it looks like we're hopefully to expand that to Thursday, Friday. HiTech Bracing, like I mentioned, is a full service orthotic facility. So we brace everything but the teeth. Our main focuses are foot orthotics, knee braces, and compression socks. But we brace, carpal tunnel, tennis elbow, back issues, you name it. We brace it all. This is my team. I could never do this by myself. As a team, we work together. I've Wayne been with me for 17 years. He's the manufacturer of the orthotics. So once I see the client and we do the assessment, nothing leaves our office. Wayne here manufactures. He's just fantastic, probably the best in Alberta for manufacturing. Next over is Irish. He's another pedorthist, another guy that likes to look at feet all day. He's been with me for 10 years. And to my right here is the most important, and that's our office manager, Audrey, and she is just fantastic, just the sweetest lady. She's so good with clients, helps them out with their insurance, and keeps me on time. But today I really want to focus on pain because most people do come to see us at HiTech Bracing because of pain. And we want to make sure that we control that pain and discomfort. Whoop, skipped over one thing. So when they come in, either be it knee pain, foot pain, back pain, what I really focus on is taking a look at their foot. So if we look at Mr. Skeleton here, so Mr. Skeleton did come in with back pain. So I said, Mr. Skeleton, that's fine. I'm going to take a look. I hear about your back pain, but let's take off your shoes. Let's take off your socks. And what do I find? So I find that his foot is extremely rotated in. So as his foot rolls in, his shin bone or tibia rolls in, his femur rolls in, his hip drops down, and it causes back pain. So it's amazing when we look at the feet and how we can focus on that person's pain and relate it to the foot. So that's really what my focus is today, because for me as a pedorthist, your feet are your foundation. They are what keep you upright. So if you were to build a house on a bad foundation, which does happen in southern Alberta and Lethbridge, it's not going to stay up forever and it's going to start breaking down. So it's really important with you having pain, we want to take a look at your foundation. So as a pedorthist, we look at your foot. So we do a hands-on foot orthotic or foot assessment where we play with your foot and massage your foot, see all the tender spots, see all the joints, how they're moving, test the range of motion, test the strength, see how loosey-goosey that foundation is or how solid it is. We also would do what's called a gait analysis. I don't need to have this fancy little machine to do a gait analysis, but a lot of clients like to see it themselves. So we do have a gait that they walk across, and I can show them where there's different pressure points, what's happening in the foot, how it can relate to their foot pain, their knee pain, their back pain. Take a look that way. And from here, of course, I need to take some sort of impression to make the orthotics with, if that's what they require. So at HiTech, we do have what's called an amphit foot impression. So we take a impression of the foot and it allows us to send it back to my lovely technician, Wayne. And he no longer has to wear a mask. He's pretty happy about that. And he manufactures it right in our in-house lab. He's there to talk to me if he's questioning the scan or if I need to have him come in and watch him do the assessment to say, hey, this is what's going on with this foot. So when you see the scan, this is what we want. So very fortunate not to have to send anything outside of our facility. Just a few fun foot facts, just to kind of break this up here a little bit for you. The average individual walks 8,000 to 10,000 steps per day. So that would be us in our lifetime circling the globe four times. That's a lot of walking. So it's important to keep those feet healthy. Our feet also have 8,000 nerve endings, so very sensitive. So we ought to make sure we keep the pressures and sensitivity under control. On an average day, your feet have over 100 tons of pressure or force through them, and that's like a load of cement through your feet every day. Girls' feet stop growing around 14. Boys, I don't know, they just keep growing. Mine is still growing, and they usually grow to about 16. Our feet are very complex, so 26, some people say 28 bones, 33 joints, and over 100 muscles and tendons that we have to look at. So there's a few things, at least like take one thing home about that today with you. Our common foot issues or pains that people will come in with is plantar fasciitis, is bunions, heel spurs, osteoarthritis of the big toe, metatarsalgia, chronic ankle sprains, aromas. These are just a few, and I thought I'll just quickly go through them. Just to maybe it'll be like, oh, that's the symptoms I'm having, or maybe it's someone you're treating and go, oh, okay, maybe this is something that a foot orthotic can help them. I'd say our #1 complaint for pain when we bring them in, it's plantar fasciitis. So plantar fasciitis is, of course, that first step in the morning, heel pain. You know, after they sit down for a long time and go to stand up, they get heel pain. Feels like it's ripping away from their heel bone. Those are good indicators of plantar fasciitis. They could have it right at the calcaneus or the origin, or it could go all the way up into the arch and into the metatarsal, the plantar plate at the front. Heel spurs, to me, I don't know which one comes first. I personally think plantar fasciitis, so the fascia starts pulling away from the calcaneus, and the calcaneus says, hey, wait a minute, I'm going to lay down some more bone, and I'm going to hold that fascia nice and tight, and it develops a heel spur. So to me, those two go hand in hand. It's definitely something we see quite a bit. Bunions, absolutely. This is something we do see. Hopefully, we like to take a look at someone that's having that valgus deformity happening sooner than later, where we can still make a correction with orthotics. We'll never get that bunion or that joint alignment to be corrected, but we want to slow down the bunion process with orthotics because that big joint is super important, and when it gets in this position, it can be very painful. Even in this position, even though we're not going to correct it, we can decrease their pain and discomfort with orthotics. We'll definitely be talking to them about shoes though. Osteoarthritis, so OA stands for osteoarthritis, and as most of you probably know, that is when the rubber or the cartilage starts to disintegrate in between a joint. So a joint is where two bones come together, and again, we have 28 bones, so lots of joints in our feet, so we can have arthritis in our feet. The most common is in that big toe. Really important area of our foot is that big toe. Metatarsalgia, this is that burning sensation in the forefoot. Some people say it feels like marbles or bruising on those bones in the forefoot, the metatarsal heads. So that's definitely something to, if you hear someone mentioning that, that potentially could be a forefoot issue, a transverse arch that's dropped that needs some support. And of course, your ankle sprain. So once you've stretched or strained your lateral ligament there, your ATFL, it is something that's, typically we need some support to support that foot in a good position. Morton's neuroma, again, that's that numb, tingling, shooting sensation in through the toes. Definitely if they've been on their feet for a bit or wearing high heels, things like that, we definitely will see something like that. So ultimately, foot pain, most people, I would say when they think of foot pain, it's not uncommon for them to think of foot orthotics. But keep in mind that yes, plantar fasciitis, bunions, osteoarthritis, that Morton's neuroma, heel spurs, ankle sprains, we can take a look at them and figure out what's going on with their foundation to see if we need to put their foot in better alignment, maybe change their pressure, take the pressure away from the bunion, take the pressure away from the heel spur, shock absorption for heel spurs, for things like that. So foot orthotics can definitely help with foot pain with those things in mind. So those, I would say, are just the most common ones, but that's not all of them by any means. But what doesn't surprise me, but surprises most people, is that feet are so hereditary. So the Hobbit feet family is legit. Like we absolutely, even today, I had this gentleman come in, excessively flat-footed. I'm sure he has a posterior tibial tendon dysfunction. And he's like, oh yeah, like my dad's got these feet, my brother's got these feet. I'm like, yeah, you all have Hobbit feet. So I always say to people, if you have kids, I need to see them. You need to send your kids to see me. If they have your feet, help them now. So family photos, it is legit. And we can usually tell by the time the child is 4 to 6, what foot type they will be. And there's more than just 2 foot types. It's not just flat feet, high arches. There's, we kind of classify them into 6 different foot types. But it is very hereditary. So we definitely like to see kids sooner than later. So like I said, around 4, I should be able to tell what type of alignment they may need or support. And we do carry off-the-shelf orthotics that are really good for kids called Little Steps. So we don't want to forget the kids' feet. These blue little steps are fantastic, $125, and they will not beat them up. So on to knee pain. Again, people coming into HiTech bracing or seeing myself, it is pain. And when they think knee, they're thinking, oh, I need a knee brace. And they might, but as a pedorthist, I will still look at their feet. So, I thought I had Mr. Skeleton coming up, but one of the more common knee pains that we deal with is when the patella or the knee isn't tracking properly. So you may hear patellofemoral, runner's knee, chondromalacia, patella dislocations. What we're really looking at is, how's that kneecap tracking for sure, and what's happening within the muscle bellies, the medial and the lateral quad. But I also want to look at their feet. So looking at this gentleman, this is Mr. Skeleton with skin on him. On the left-hand side here, looking at how much, again, his feet are rolling in, tibia is rolling in, kneecaps are misaligned. He was having patella tracking issues, chondromalacia, grinding, clicking, you name it. Probably some IT band issues. But once we put him in proper shoes, see they're not laced up, with some orthotics, getting him in good alignment, better foundation down here, it definitely helps with the patella tracking issues. Another common knee issue that we have or see a lot of in our clinic is osteoarthritis. Again, going back to osteoarthritis is when the rubber or the cartilage starts to disintegrate in the joint. So of course, taking a look at this x-ray, we'll see here that there's not as much space on this medial aspect as there is on the lateral aspect. So this gentleman has a medial osteoarthritis. This gentleman definitely has medial osteoarthritis. I can see here that his knees genuvarum. He will definitely still need a knee brace. We do provide him with an unloader knee brace, but I can take a look again at his foot foundation and put him in good positioning through the feet as well and shock absorption to help with his knee pain. Because I get it, they're not going to wear their knee brace all the time, but they will wear their shoes 90% of the time. pain. So again, someone comes in with foot pain, they're going to expect foot orthotics. The knees and the backs are a little surprised when we say, well, let's look at your feet. And again, going back to Mr. Skeleton, if that one foot is excessively pronated and the other one's not, we will see a constant rotation happening through that whole body. So everything's rolling in on that left-hand side, everything's twisting and turning. If we get him in better foundation at the foot, guess what? That really aligns his back, and therefore the muscles in the back don't spasm as much. His SI joint isn't out of whack constantly, you name it. So again, what we really want to do with foot orthotics is align that foot in a proper position. So align, make sure he's got good foundation in the foot. Make sure that it's, one foot's not rolling in, keep it in good alignment. We want to disperse pressure throughout the foot. So someone comes in with a really high arch. So typically someone with a really high arch, a pes cavus foot, they're going to have a lot of pressure on their heel and a lot of pressure on their metatarsals. And we need to disperse that pressure from the heel all the way to the toe, not just a tripod effect walking on, the heels and the metatarsals. We always want to add some shock absorption. If they've already lost their fat pad in their heel, we definitely need to add some more of that as well. So that is my main goal for foot orthotics. Now on to shoes. So I was always told I need to be a little bit funnier, so I really try, but here you go. Will you please put on some shoes? You mean foot prison? No, I will not. Shoes should not feel like prison. Shoes are a huge part of taking care of your feet. And there's definitely the bad shoes versus the good shoes. So we're just gonna have a quick chat about shoes, because I can build you the best foot orthotic in the world, but you need to put them in something. So just briefly, a couple of things to think about when you're looking at all your shoes in your mudroom. Are my shoes too old? So like we said, 8,000 to 10,000 steps a day. You should be replacing your walking shoes or your shoes you wear to work every 6 to 12 months tops. If you are a runner and you're putting more than that through, so the 8 to 10,000 is average, but if you're doing 20,000, you're probably replacing those. If you're just running in them 6 months, if you're running and walking in them, you're probably replacing them 3 to 6 months. So definitely need a good foundation in the shoes. Women, too tight of a shoe. Absolutely, if your foot is like, I don't know, 6 centimeters wide and you're sticking into a 3 centimeter, well, that's too small, but 5 inches and you're sticking into a 3-inch shoe, that's too tight for you. So sometimes I physically have to show the person that their foot physically won't fit into this shoe unless we're squeezing it in. That's no good, especially when we're dealing with bunions and aromas, that metatarsalgia we talked about. We need to get away from that. Too soft. This is the one that probably surprises people the most, because they love their Skechers and their Crocs, and I know cushioning's nice, but if I can take your shoe and I can wring it out, it's too soft. So we don't want it too soft. A good shoe, something with a hard heel counter, we can't wring it out. It has a kind of a stiffer toe. I can't kind of do what's called a break point on it. You don't need to spend a lot of money on it. You just need to know what to look for. And as a pedorthist, we definitely go through that as well. I said I would touch a little bit on compression socks. And I know Robin Devine did a wonderful presentation. If you go to her YouTube channel and take a look at that. So I just want to touch on compression socks because I love my compression socks. And I know we hear more and more about them. So one question is, who should wear them? And I'm thinking everyone should wear them. 1 in 4 people will develop a vascular issue. However, I'd say 99% of us wear compression socks in the winter around here. So why not wear some that are good for you? Be it if you're a weekend warrior out running, you're traveling, you're sitting at your desk all day, you are working on cement, you would just like to get out and do your activities, your hiking, your biking, you name it. Why not wear socks that are good for you? So and I said this, 1 in 4 will get a vascular disease. Well, what is a vascular disease? So again, not to get too in depth, but a vascular disease is more, I spelled spider wrong, but looking at, again, if you're seeing someone on their massage table or in your clinic and you see they have spider veins, varicose veins, some edema, pigmentation issues, they're complaining of chronic leg fatigue, restless leg syndrome, they've had a history of blood clot, DVT, those are all signs of vascular diseases, and their vascular system needs help. So compression socks are there to help. So they help improve circulation, reduce varicose veins, control the swelling, and reduce leg fatigue. And they look cute. So the whole idea again is, what do the socks do? I picture it like this. So a normal vein on your far left has this nice stiff wall, and that stiff wall contains the blood, it contains the tube, I call it, and allows the blood to be pushed up, keeps the valves going in the right direction. But as we age, or as our veins become a little weak, the walls tend to soften. And as they soften, the blood starts to pool in the bottom part of the vein, and the valves become too open. And guess what? Blood starts to pool, we start to see the edema, or we pull your sock off and you have that indentation at the end of the day, or you're starting to see little varicose veins and spider veins. That's a sign that your vein wall has become too soft, not stiff. So we want to add some stiffness to the outside of that vein and push it together. So the sock adds a little bit stiffer wall, squeezing the vein together and giving it some structure again. And the whole idea is, we don't want to cut off circulation, we want to improve circulation. So 100% of the compression is down at the ankle, less and less as we go up the leg, squeezing that vein from the bottom up. So it pushes the blood, keeps the valves in the right direction, pushes the blood back up to the heart. And we have all types. So they're not the old lady granny types anymore, although I still have those, and some of my ladies love them, the skin tone color. But absolutely, there's sports socks, there's ladies dress socks, there's thigh highs, pantyhose, men's dress socks, sporty socks, all different colors, you name it. So let's go to recap on everything, and the fact that we don't want to forget the feet. We want to make sure that your foundation doesn't look like Mr. Skeleton on the left-hand side, but we want Mr. Skeleton in good foundation, good alignment. So I'd be happy for you to book a foot orthotic assessment to have your foundation checked. And we'll definitely look at your shoes, see if they're too old, they're too tight, they're too soft. And if I happen to see some vascular issues, absolutely, as a pedorthist, I do recommend that you speak to your medical doctor about medical grade compression socks. So I'm going to go through just a couple of the frequent questions that I have, and then absolutely, if there's anything at the end, love to help answer some more. So number one is cost, like how much is it going to cost me? Absolutely, there's no charge for an assessment. So at HiTech Bracing and as pedorthists, we don't charge for our foot orthotic assessments. We usually spend about 45 minutes with the person. Custom foot orthotics are $480, and compression socks, knee-high compression socks I threw on here were $120. Insurance. So does any of my insurance cover this? And everyone's insurance is slightly different. Most extended healthcare plans, such as Great West Life, Sun Life, Manulife, Alberta Blue Cross, do have coverage for custom foot orthotics. It's usually a dollar amount every calendar year. Most do require a prescription. My lovely office manager here and Harley do assist. They do their best to assist. Obviously, with the Privacy Act, sometimes it's difficult for us to call in. But ultimately, we do our best to help you figure out what's your coverages for foot orthotics with the pre-authorization. And same with compression socks. Usually there is, people are surprised, but coverage for medical grade compression socks through their private insurance. As Albertans, sometimes we can get coverage through Alberta Aids to Daily Living as well. But private insurance is definitely the best way for us to go. Direct billing. So unlike massage therapy clinics, medical supplies typically aren't able to do direct billing for our services. There's a few extended healthcare plans out there that allow it, but for the most part, it's pay, submit. Absolutely, my lovely office manager gets all your documentation ready for you, gives you a nice package when we hand you your orthotics for you to submit in for reimbursement. So definitely want to book an appointment. Like I had mentioned, happy to see you in Calgary now at the Lymph Balance Center. I'm also at Calgary Muscle Soft Tissue Clinic. We're there every second Thursday, or you can come down to Lethbridge and see us down here. Best way to do this is to give us a call, and I do have a 1-800 number, but for sure call 403-320-6661, or you can call toll free at 1-888-742-1099. We'll find out where's the best place to meet you. Is it in one of our 2 Calgary locations, or have you come down to Lethbridge? Or you can always email us or go right to our website, which is hitechbracing.com. And that's all I have to talk about when I really, again, as a pedorthist, I want to look at the feet. I want to keep them healthy, and pain-free.